I'm Audrey. This is our head-to-toe assessment on a healthy patient for our assessment course. Our patient is a 27-year-old female who presented today to the clinic just for a healthy patient exam. Prior to this, we've gone over her vital signs, which were within normal limits. We've also gone over her family history, surgical history, medical history, as well as her home medications and allergies. The patient is a very healthy patient with no chief complaint, just here for a healthy patient workup. I've also washed my hands, and prior to coming into the room, we've assessed her vision using our Snellen chart, which tests cranial nerve number 2, the optic nerve. With the patient's glasses on, that was within normal limits. So now we'll proceed with our head-to-toe examination. When you do your head-to-toe, you always start at the head, work your way down to the feet. So the first thing I'm going to do is approach the patient, look for overall symmetry, making sure the eyes are symmetrical, ears are symmetrical, nose is midline as well as mouth. I'm going to start by just palpating the head. I'm going to make sure that the patient has no signs of tenderness, grimacing, anything like that. I'm also going to assess the hair for thickness. I'm going to assess for any baldness or thinning, any complaints related to the head. The patient has no complaints, so I'm going to move on. I'm going to look at the patient's face. Everything appears symmetrical. So at this point, I'm going to start with the eyes. Now when I'm examining the eyes, I'm going to look at her pupils, making sure that they appear round and within normal limits, which they do. The next thing I'm going to do is I'm going to ask the patient to follow some basic instructions related to her eyes. So the first thing I'm going to do is look into your eyes. What I'm going to do is assess the red reflex, as well as perla. I want to make sure that the pupils are equal, round, and reactive to light, as well as accommodating to each other. So if you'll just follow my light, okay? Perfect. We're going to do the same thing on the other side. Perfect. And her pupils appear within normal limits. While I'm here, I'm going to go ahead and look at her sclera. I'm going to make sure there's no redness, no drainage, anything abnormal with the eyes. So you can just look forward, and I'm going to look here. All that appears within normal limits. So now I'm going to move on. If you'll just follow some basic instructions for me, you can put your glasses back on. I want you to look at my finger and then at the back wall and then back to my finger. Perfect. So this just tests the eye movements, making sure that they can do what they're supposed to do. Now, if you'll also follow my finger, we're going to do a series of movements, okay? So we're going to start here, follow my finger here and back, here and back, here and back, here and back. Perfect. So the patient has full movement of her eyes. And that tests cranial nerves number 3, 4, and 6. Just making sure the eyes can move in all directions as well as accommodating to each other. So while we're right here, I'm also going to look at the nose. I want to make sure there's no inflammation or swelling, any complaints with the nose. The patient denies any complaints and I don't see any redness or obvious drainage. I'm going to look inside the nose while I'm here. And what I'm doing is just assessing the mucosa. I want to make sure mucous membranes are moist and that there's no tearing or lacerations or ulcerations, anything that would be concerning. I'm just going to look in your nose. That looks great. And that looks great. While I'm here on the nose, we're going to test her olfactory nerve. That's the one for smell. So you'll close your eyes for me. Tell me what you smell.
Alcohol.
And on this side?
Alcohol.
Okay, so cranial nerve number 1, olfactory, is intact. Okay, moving on, we're going to go to the mouth. The lips appear symmetrical. I don't see any drooping or any abnormalities. I'm going to look in your mouth for abnormalities, okay? At this point, we ask the patient to open her mouth. What I'm looking for is I'm assessing the tongue, the teeth, the mucous membranes, and then I'm going to ask the patient to move her tongue. So move her tongue up and down and side to side. Perfect. Her mucous membranes appear moist. Her mucous membranes also appear pink. I don't see any redness. I don't see any white patches on her tonsils. Her throat doesn't appear reddened or inflamed. What I also did was I tested her cranial nerve number 12, her hypoglossal, just making sure she has good movement of her tongue. I also assessed cranial nerve number 9, which is the glossopharyngeal, which is responsible for taste and salivation, which since our mucous membranes are moist, we can see that those are intact. While I'm right here at the head and the face, I'm going to move on to her ears. The patient has denied any complaints with her ears, but we're still going to assess We're going to make sure that the tympanic membrane is pearl and mobile, making sure she doesn't have any signs of infection in either ear. To do this on an adult, you would pull up and back. On a pediatric patient, we would pull down and back. That one looks great with no signs of infection, so we just move to the other side and do the same thing on this side. Great. Her ears appear within normal limits. They're also symmetrical, so we can move on from that. I don't see any abnormalities. She denies any tenderness on either ear, and I don't see any redness or signs of infection. When I'm moving on, I want to look at her face. We need to test cranial nerve number 7, which is the facial nerve. So if you could just raise your eyebrows up and down and smile for me. Perfect. So that just shows that she has full function of her face with that cranial nerve intact. While we're right here, we're also going to test your sensation on your face. So if you'll close your eyes. And I want you to tell me if this is soft or sharp, okay?
Soft. Sharp. Soft. Sharp. Soft. Sharp.
Perfect. So that's intact. She was able to tell me the difference between soft and sharp senses, which shows that all of her senses in her face are intact. And everything on her head and face appear normal, so we're just going to keep working our way down. Now, while we're right here, I'm going to assess her carotid arteries since we're right here. You do these one at a time on each side. Left side is +2 and within normal limits. Right side is +2 and within normal limits. Okay, great. Now, if you could shrug your shoulders up and down. Perfect. That's testing our cranial nerve number 11, the spinal accessory, and she's able to have full range of motion with that. While I'm here, I'm also going to assess range of motion of neck and shoulders as well as strength. So what I want you to do is I want you to lean side to side like this. Perfect. And I want you to go down and up. Perfect. So that just shows that she has full range of motion of her neck. Now with your shoulders, I want you to kind of do the same thing, just up and down and then moving them around. Perfect. Patient has full range of motion of her shoulders and neck. Now I need to test your strength. So what I'm going to do is I'm going to have you look side to side, but I'm going to give you a little bit of resistance, okay?
Okay.
So I'm going to put my hand here, and I want you to look that direction. Perfect. Okay, same thing on this side. Good. Patient has 5 out of 5 strength in her neck. We're now going to do the same thing on her shoulders. I want you to push up on me while I give you a little bit of resistance.
Okay.
Perfect. 5 out of 5 strength she can perform without any difficulty. So now I'm going to go ahead and move on to her neck. Patient denies any issues with her thyroid. We're still going to go ahead and assess for the presence of a goiter. So what I'm going to do is I'm going to stand behind you and put my hands on your neck. I just want you to kind of lean back and give me a big swallow, okay? Perfect. No signs of a goiter. She also has no inflammation and no tenderness when I'm touching on her neck. She also proved that she has full range of motion of her neck and that I could palpate her carotid arteries. So now we can move on. While we're talking about arteries, I'm going to go ahead and just come back to these temporal ones here and make sure that I can feel those. I'm going to just move your glasses down. All right. And they're +2 and within normal limits. So no issues there. I also want to assess her jaw. We need to make sure that she's able to open and close her jaw without any clicking or pain or tenderness. So just open and close your jaw. I don't feel any obvious clicking, and the patient denies any tenderness when I'm pushing. So we can move on now to her chest and her back. So there's a lot of organs here, and what we're going to do is do a lot of things at once. We're going to start with you just swinging your feet to that side and sitting on the side of her head. I'm going to untie the back of her gown so I can perform these tests. So one thing I look for here is the whole time I'm moving down, I'm assessing her skin. I'm assessing for any contusions or bruising, ulcerations, any abnormalities to the skin or discolorations that would be of concern. And she has none so far. So I see that right now everything is symmetrical with no issues. I'm going to put my hands right here on her back, and then I'm just going to ask her to take a big deep breath. Perfect. So chest rise is equal, symmetrical. So now what I'm gonna do is you're gonna take a couple big deep breaths. I'm gonna fill in your back, and the whole time I'm doing it, I just want you to say 99, okay? So just say it over and over.
99, 99, 99.
Perfect, you can stop. So what I just tested for is tactile phragmitis. If I would feel any abnormalities there, it could be an indication of emphysema or COPD. I don't feel any, and everything feels within normal limits. So we can move on. What I do now is I'm going to go ahead and percuss her back, testing for the same thing. If I were to hear anything other than just resonant sounds, that would be an indication of abnormalities in the lungs, like fluid or air in a pocket that shouldn't be. So I'm just going to start at the top, and I'm just going to work my way around. Okay, great. I don't hear any abnormal sounds when I'm percussing, so I'm going to move on and I'm going to listen to her lungs. This is going to be cold, and just breathe normal. I don't hear any adventitious lung sounds such as wheezing, bronchi, or rills. Her breathing appears within normal limits, and she's not showing any signs of struggling. I'm going to do the same thing and assess for tactile phragmitis as well while I'm listening. So just repeat the term 99 until I'm done listening, okay? 99. Perfect, you can stop. All that sounds within normal limits. So I'm going to go ahead and now I'm going to assess the front part of the patient. So you can go ahead and lean back on the bed. Now, for a normal exam in the office, I would go ahead at this point and take the patient down to her bra. That way I could assess. For this health assessment video and for Amber's comfort, we're going to go ahead and leave the gown on. But normally I would try to get the patient as uncovered as possible to fully assess. So right now what I'm going to do is I'm going to do the same thing I did on the back. I'm going to start with just inspection, and if the patient did not have her gown on, we would be able to see her skin. I would assess for any abnormalities or redness, discolorations that would be concerning. Assuming that we don't have any on this patient, we'll move on to percussion. When we percuss, we do the same thing we did on the back. We're just listening for any abnormal sounds, for COPD, emphysema, air, anything that shouldn't be where it's supposed to. So we're just wanting resonant lung sounds here, okay? Perfect. And she does not. That's within normal limits. So now I'm going to listen to her lungs on the anterior side just to make sure there aren't any adventitious lung sounds. You can just breathe normal. Okay, great. I don't hear any adventitious lung sounds on the anterior side either. I'm going to go ahead while we're right here and I'm going to listen to her heart. The overall goal is I want to hear S1 and S2 strong. I don't want to hear any murmurs, any gallops or runs. We're going to listen to 5 spots. I'm going to start here in the second intercostal space, moving on to this second intercostal space. We're going to move on down here to the third and fourth intercostal spaces, as well as the fifth down here, her point of maximum is her mitral valve. S1 and S2 are heard prominently with no murmurs, runs, or gallops. The patient also has denied any chest pain or tenderness with their chest, so we can move on from there. And now what I'm going to do is, while we're right here, I'm going to perform 2 tests for her hearing and air conduction. We're going to perform the Rhine test and the Weber. So what I'm going to do is I'm just going to place this on top of your head, and I want you to tell me if you feel it equally on both sides, okay?
Okay, she's over here.
Perfect. Okay, so now we're going to test the difference between air and bone conduction. It should be 2 to 1. So what I'm going to do is I'm going to place this behind your ear. I want you to tell me when you stop feeling it, and I'm going to hold it to your ear and tell me when you stop hearing it. Okay? Perfect. So it is supposed to be 2 to 1, and hers is within normal limits. We would perform this on both sides to ensure that both are equal. Now, we've done everything we can do with the patient in this position. The next thing that I'm going to do is I'm going to lay the patient flat so I can move on to the abdominal region. Okay, we're going to lay down flat. Okay, when we get to the abdominal region, the first thing you want to do is inspect. You're looking for any hernias or any distension, any concaveness. You want to make sure that the abdomen appears soft and round. So I'm going to lift this up here. Her abdomen appears soft. I don't see any signs of a hernia or discoloration. Then the next thing I'm going to do is auscultate. You want to auscultate before you palpate because you don't want the vowel sounds to be distorted from the palpation. And we're just going to start in this right lower quadrant. I'm going to work my way around.
Are you understanding? Okay, you wanna follow me back? Give me just a second. I'll get it for you. Okay. It's in the red pot, it's in the red.
Her vowel sounds are normal, active. If I were able to hear any vowel sounds, I would need to listen for at least 5 minutes per quadrant just to make sure that I was hearing accurately. So now I'm going to move on to palpation. What I would do at this point is just push on her abdomen. And what I'm doing is just light palpation, assessing for any signs of tenderness, which she has none. She's not grimacing and not saying that anywhere hurts. While I'm right here, I'm also going to palpate on the sides just to see if I can feel anything abnormal over here, which I don't. I'm moving on now to deep palpation. This is to palpate for the liver and the spleen. I'm going to palpate pretty deep up here. I'm going to put my hand behind her back and try to palpate for her liver. Which I can feel it. It's soft and it's round. She's not grimacing or any signs of tenderness. I'm going to do the same thing on the other side for the spleen. I'm going to put my hand back here and just attempt to palpate for the spleen. I can't feel the spleen, which is normal. You don't want to feel the spleen because then it would be a sign that it would be inflamed or enlarged. And I can't feel the spleen. And she's not grimacing or having any signs of tenderness on that side. I'm going to attempt to palpate each kidney. She's not grimacing or showing that that has any sign of tenderness. Okay. No issues there. I'm also going to percuss. The percussion should normally be done before you palpate. When I'm percussing, I'm going to assess for the liver margins to make sure that it's not enlarged. I'm also going to percuss over the spleen, assessing for any dullness. I'm just percussing, looking for her liver margins. It appears within normal limits, and I don't see any signs here of any swelling on that side. So now what I'm going to do is I'm going to go ahead and have her sit up. I'm going to tap on her back just where her kidneys are, her costovertebral angle, and I'm just assessing for any kidney pain over her flanks. Does that hurt at all? Any pain? Perfect. She didn't grimace or wince when I tapped on either side, so that appears within normal limits. Okay, moving on, we're going to do some range of motion exercises on her legs. So I'm going to go ahead and have you lay back down since we've progressed on your kidneys. So are you having any hip or knee pain? Perfect. So I'm just going to do some passive range of motion, just trying to relax these legs. So what I'm going to do is I'm going to take her foot here and her leg, and I'm just going to bend her knee. We're adducting and abducting here, as well as internal and external. Are you having any pain right here with any of this? Okay. I'm also going to assess the knee while I'm here. So I'm going to actually lift this leg up. Any pain here? Same thing outward? Perfect. So I'm going to come around. We're going to do the same thing on that other side. And we're just going to bend up. No issues there. And then we're going to come out and in. Externally and internally rotating. Great. She's not having any signs of musculoskeletal difficulty. So now I want you to put your toes towards your face and back down. So we're just doing dorsiflexion and plantar flexion, making sure she has full range of motion in her ankles. She appears to have 5 out of 5 strength and range of motion in her hips, knees, and ankles at this point. While I'm doing this, in a normal patient exam, I would have the patient where I could see their legs. I'd be assessing for any varicose veins or any skin discoloration as I was making my way down. For this, we're going to assume that she's within normal limits. While I'm down here, we're going to go ahead and just assess pulses. We're going to take these socks off just for a second. So I want you to tell me sharp or dull. We're going to make sure that she has filling in her feet. I want to make sure that she doesn't have any nerve issues or anything like that. So I'm just going to test soft and sharp on her feet as well. So can you feel this? Sharp or dull? Sharp. What about here? Sharp. Sorry. Okay, here, soft or sharp? Soft. Okay, here? Sharp. Okay, perfect. So she has filling in both feet, which is something we worry about. In diabetics, we want to make sure that they are able to feel and have full healing in their feet. We're going to go ahead and have you twist your ankles around both ways. Perfect. So she has full range of motion in her ankles and her feet. I see no abnormalities, and I was able to feel her pulses, and they were +2 on her feet. Okay, so we're going to do just some basic range of motion now at this point. So we're going to have you sit up and stand on the side of the bed. Okay. This way? And then what I want you to do is I want to assess your spine. So I want to see if you can bend over and touch your toes, and I'm going to run my fingers down your back as we go. Okay. Like this? Perfect. Are you having any pain anywhere when you do this? No. I'm not feeling any raises or any issues with the spine. She appears symmetrical with no signs of scoliosis. Okay, you can go ahead and stand back up. Now I want you to close your eyes and stand there. I'm assessing for dizziness and balance. Okay. So. Great. So that is her cranial nerve number 10. I just want to make sure that she's able to stand without being too wavy or any signs of dizziness. All right, you can go ahead and sit back down. This concludes our full head-to-toe assessment. I was able to go all the way from head to toe with no issues. Oh wait, I do want to test one more thing. I want to test her reflexes before we call it good. Have you had any issues with your arms or legs? Okay, great. I'm just going to assess your reflexes real quick. So we're just going to bend down like this. Perfect. Same thing on this side. What I'm doing now is just testing brachial reflex. I'm going to also do the wrist. Same thing here. She's not showing any signs of tenderness, and it's also bouncing +2. I'm going to come here. Perfect. Perfect. Her reflexes are intact. Okay. All our reflexes appear intact, so now this will be the conclusion of our head-to-toe assessment. All right, thank you. Amber, you can step out. Thank you. Now, in a normal, healthy exam of a woman, we would also need to assess breast, and pelvis. And we would do this at the very end because it's the most uncomfortable part of the procedure. The way that we would do the breast and the pelvis is that the patient would need to be in a supine position with arms above the head. And then me as the nurse practitioner would start with whichever breast the patient was more comfortable with. I would start in the middle. I would progress all the way down, palpate all the way down, working my way in an angle like this here, up and down, up and down. I would go all the way to the outer portion of the arm here. And that's important to go all the way out because this is a common place for breast cancer. You're feeling for any nodules or tenderness. You're also assessing the nipples for any cracking or abnormal discharge. You would do both sides, and then after that you would move on to the pelvic exam. The pelvic exam with the speculum would need to be done on the patient in a supine position as well, with their knees up and out. That way you can have full examination to inspect. When you're inserting the speculum, you just make sure that you explain the procedure calmly to the patient. You also need to make sure and use a water-based lubricant. That way if you're obtaining any specimens, the lubricant doesn't interfere with that. When you're inserting the speculum, you always go at an angle and then straighten up and then slowly open the speculum so that you don't cause the patient any discomfort. When you're obtaining your specimens, especially a pap smear, you want to make sure and get an adequate amount of endocervical cells to make sure that the specimen is adequate. Now, when you're done with the speculum portion, you slowly remove the speculum, and then at that point you perform a bimanual exam. The bimanual exam is performed by inserting 2 fingers into the vaginal cavity and then putting the other hand on top to percuss down. And what you're doing is deep palpating for the uterus and the ovaries, making sure that you don't feel any abnormalities or tenderness when palpating those areas. After the bimanual exam is done, that would conclude your pelvic examination, unless the patient had further concerns with that. That concludes our head-to-toe assessment on a healthy female patient.